Well, hospitals in the hardest hit parts of England could run out of beds for COVID patients in a week. That's the warning from health chiefs because of so many new infections. It comes as the largest coronavirus study of its kind found that cases are doubling twice as fast in the north compared to the south. Well, a health correspondent, Katherine joins me now. So, Katherine, it's looking like the epidemic is really having a negative impact on the NHS once again.
It was really only a matter of time before September's sharp rise started feeding through into our hospitals. And alarm bells are ringing loudest in Liverpool, where, as you said, some hospitals are now reporting they could be at maximum capacity in 7 to 10 days. But it really is across the northwest and the north of England that the pressure is being felt. Here's a snapshot from 2 doctors working on the front line in Preston.
We'd gotten to the point where we had almost no patients testing positive for COVID in the hospital at one point in the summer, but those numbers are now very steadily increasing, including some of the sickest patients in the hospital.
We're doing everything that we can to try and prevent the need to cancel any operations, and so far we're managing, we're coping. So it's really imperative that we try and push through the operations that need to happen, especially on the intensive care side of things.
The message that it is going to be hard work, and we would ask the public to support us by following all the public health messaging, wearing the mask in public places, washing their hands, following the rules on social distancing. Every person who doesn't get COVID is one less that we won't have to see and to look after, and makes life a bit easier for the NHS.
So into the detail now, and in the northwest of England, as you heard, the effect on the NHS is emerging first. The number of people admitted with COVID to hospital there has shot up almost 60% in just 1 week. It's because of the high infection rate in the region. According to the latest estimate from the largest testing survey, 1 in 100 people in the northwest are now infected. Both that study and the Office for National Statistics conclude the northeast of England and Yorkshire and the Humber are the 2 other areas where the virus is most rampant, and the best estimates for how quickly the number of cases will double there range from 13 to 17 days. Now, leading doctors say it is only a matter of time before in those regions we are going to have to start cancelling operations.
We're really keen that it's possible to treat cancer, get operations done, but we're going to have to find the point at which that's going to have to stop if places are getting very, very full. We can't have the sort of winter pressure, patients in corridors that we had last winter, and have COVID cases as well, and have the loss of capacity and productivity that you get because of doing social distancing and infection prevention and control measures. It just can't all be done.
So, Katherine, what about the broader picture?
Well, across England, the REACT study estimates that 1 in 170 people are currently infected. The ONS puts it slightly a better picture at 1 in 240. But the number of cases doubling every 29 days. So that does sound slightly more reassuring. But although that is certainly buying the NHS time, the researchers are clear the epidemic is growing in all areas across all age groups as winter is approaching.
Gosh, Katherine, so much to take in. And thank you very much for that update. Thank you.